Hello and welcome to the What Caregivers Need to Know video show by eCareDiary.com. I'm Susan Baida and your host for today. I'm very excited because we're talking about a topic that is not very traditional, and it's in keeping with our whole theme this week about holistic medicine. So I'm very excited to introduce Bobby Cullinane. Bobby Cullinane is the president of Options for Elder Care, which is a holistic life care management practice in Pittsburgh, right here in Pittsburgh. And she's a certified case manager and currently on the board of directors of the National Association of Professional Geriatric Care Managers, NAPGCM. Bobby is also a certified holistic nurse and a certified clinical aromatherapist and Ursi Reiki Ryoho second degree. I hope I got that all right.
It's a lot of words.
You can find more information about Bobby at optionsforeldercare.com. Welcome, Bobby.
I'm very excited to be here and get the news out about aromatherapy and how effective it is.
Yes, let's talk about this. I'm fascinated by the fact that you're a nurse and that you're a believer in aromatherapy benefits as an alternative way to care for yourself and a loved one. So with your education and background rooted in modern medicine, how did you become interested in aromatherapy?
So what led me to this is I work with a lot of aging, most of our clients are 80 or above. And when we initially do an assessment to help them, they're usually in a crisis. They're in a crisis, a physical crisis, a cognitive crisis, a pain crisis. And when we're doing the assessment, we're finding it's only being treated, most of their symptoms are treated with medication. And no one is finding out what's causing the issue, pain per se. They're just giving them an opioid or they're giving them a pill. Right. So we find tremendous polypharmacology. We find clients that every time they're admitted to the hospital, they get a lower level of functioning when they leave, and then they end up in a skilled facility and come out continually at a lower level, poor quality of life. So I was grasping for things in modern medicine that would help me with that, and I just couldn't find it. So what I through searching out and having a client, a very holistic client who got me on board with this, I've incorporated modern traditional medicine with modern medicine, and it has made a great mix, and the quality of life of my clients has improved by, if they're agreeable, by implementing it, one of the things being aromatherapy.
This is so incredibly innovative. I'm excited to learn more about it. So I've heard of aromatherapy. I think the term clinical aromatherapy is new to me. So can you share with us what that is?
Yeah, so what you're doing is you're using the essence of the flower in a therapeutic way. And to get certified, you have to have a medical background. So it's very different than there's lots of companies that sell essential oils, and people can become a selling person of that and take classes through that. It's very different than that. Right. We are using any essential oils that I use, I'm picking it from the country where it vibrates at the highest level and is the most effective. So it's and I'm using it clinically. So I'm using it for symptoms that people are having and giving them autonomy to be able to help them manage their own symptom themselves.
I'm excited to learn, I guess, about some examples in which you've implemented. So what's, I guess, one of the more popular aromas, essences that you use?
Okay, so we have a horrible outbreak in this geographical area with the flu, as probably our whole nation does. Yes. So one of the most effective ways, and I have clients that don't take the flu shot, even despite lots of encouragement for them to take it. So what I created, and this has been tried over a 4 or 5 year period. It's a aromatherapy that's in a base, a cream base, the holistic cream base that has 6 different types of essential oils added to it that have different therapeutic properties. So I'll just explain, for instance. It has thiamine, frankincense, eucalyptus, tea tree, and Rista vera, and they all have properties that when mixed together will help you with the flu. For instance, thiamine is an immune stimulator. So it increases the production of white blood cells in your body, and it's an antibacterial and it's an antiviral. There's eucalyptus, which everyone's familiar with that, the old Vicks Vapor Rub, is a bronchodilator. So it works to open your sinuses, combats fever. Tea tree is one of the most effective essential oils for getting rid of any kind of bacteria, and it's an immune stimulator. So what these do is they not only, you can use them as a preventative measure, or you could use them when you're having the symptoms. So it's going to increase your body's ability to fight any kind of infection. The best way to use any essential oil is to absorb it through your feet. So I'm not sure if you want me to go there. I could explain how the ways you can use essential oils. So there's different ways you can use them.
In this case, you can use this and rub it.
The best way to use this, right. So what you can mix an essential oil and a cream base. This is mixed in an organic cream base.
Okay.
And I list the properties on there so that people know what it is. And the best way to use, if you're using it in a cream base, or you could also mix it in an oil, like this is a grapeseed carrier oil. Mm-hmm. They're called carrier oils when you're mixing it in. Here's another example. Here's fractionate coconut oil. Mm-hmm. So when you're using any kind of liquid base, you're getting to the property. So it's actually being absorbed through your bloodstream, mm-hmm. and you're also getting inhalation of it. So it's working both ways. The best way to use it for absorption is through the bottom of your feet.
That's
so
fascinating. I had no idea.
Yeah, it absorbs much better through the bottom of your feet. People like the smell, so they'll put it on their chest, but it actually does.
That's a great tip.
Yeah.
Now, let's talk about maybe some of the ailments that many of our seniors face. What types of aromatherapies do you use in maybe some of those instances?
So you'll have lots of, with older people, aches and pains. They may be called arthritis. Right. They may be called whatever, however it's diagnosed. So you want to use, I'd pick a combination of essential oils that that have anti-inflammatory properties.
Right.
One of the best anti-inflammatories is frankincense. So frankincense mixed with maybe a couple other, depending on, and it's individually based usually, the symptomatology they're having. But frankincense is a great anti-inflammatory. I am 55 myself. Every morning when I get up, I have a little bottle of frankincense by my bed, and I'll put it on the bottom of my feet or before I go to bed at night.
Again, so that as well you can put on the bottom of the feet. Because my first inclination would be to rub that into your joints or something like that.
You can put it on the bottom of your feet. You can put it on, if you want to combine this with, say, traditional Chinese medicine, you can put it on acupressure points. Okay. The acupressure points that have to do with inflammation, where the inflammation is. So I try to, use a lot of ancient medicine in my practice.
So where can people learn more about, I guess, these different essences? And, well, we know about your site. If you want to learn more about Bobby, you're at optionsforeldercare.com. And do you have information about these herbs and aromatherapies?
If it's a clinician, so if it's a nurse, a physician, probably the best thing to do, you can self-educate, but I will give probably the best clinical aromatherapist a little plug here. Her name is Jane Buckle. She teaches courses It's a long certification process, but on clinical aromatherapy.
Great. And she has a forward there by Dr. Oz, so that's a great
Oh,
endorsement.
yeah, she does have she's travels the world teaching people about aromatherapy. If you're a person that just wants to learn more about it, I mean, there's tremendous information on the internet. Or this is a really great guide to teach yourself. I just got this off of Google, and what I like about it, it has lots of pictures in it. And it's written in layperson's terms, and it will give you, tells you what each kind of essential oil is used for, some of the properties, cautions for use. So
What
it's a
is
real
this?
simple guide.
This is called Aromatherapy, an Illustrated Guide by Claire Walters.
And hopefully it's still available. And then I have, these are encyclopedias, and so clinically I will use those to make sure when I'm using combinations there's nothing dangerous.
Well, Bobby, thank you so much for enlightening me and our audience about the benefits of clinical aromatherapy. I'm incredibly excited. My mother has rheumatoid arthritis, so we're going to be following up with you about maybe some concoctions that we can put together for her. Thank you all for joining us today. Visit us at ecarediary.com for further information. And if you weren't able to see this show live, of course, we have not only this show available in archive, but other shows as well. Thank you, and join us again.